Urinary incontinence, or bladder leakage, is the involuntary loss of urine. It is a health condition that affects millions of women. Urgency urinary incontinence is the type of urine leakage that happens with a sudden and strong urge to urinate that is difficult to control. Related symptoms may include frequent urination during the day or night. This condition is also known as overactive bladder, or OAB. Normally, when the bladder fills with urine, the bladder muscle relaxes to allow urine to be stored. As the bladder fills, stretch sensors in the bladder send a signal to the brain, felt as the urge to urinate. We can control this urge by contracting the pelvic floor muscles. The contraction is a signal to the bladder muscle, instructing it to relax and continue to store urine. With urgency incontinence, or OAB, these signals are disrupted. The bladder muscle contracts too often or too soon, creating the sensation of a strong and sudden urge to urinate. When the pelvic floor muscles are weak or not working effectively, they are unable to help control this urge, and bladder leakage may result. Exercises to improve pelvic floor muscle strength and function are a recommended first step in treating urgency urinary incontinence. The Leva Pelvic Health System rehabilitates and trains weak pelvic floor muscles in women by providing visual feedback and instruction to guide pelvic floor muscle exercise. Leva's flexible vaginal wand contains motion sensors that detect lift and squeeze movement during a pelvic floor muscle contraction. These sensors communicate with a smartphone app where the pelvic floor muscle contraction is displayed visually on the smartphone screen. This real-time feedback helps to guide correct and consistent pelvic floor muscle training, allowing the rehabilitation and strengthening of weak pelvic floor muscles and improvement in symptoms of urgency incontinence.